At the external female genitalia, these are the external reproductive features that are found in females, and collectively, this forms the vulva. So we want to think about these structures. First off, we've got the mons pubis. This is the fatty region that is typically covered with hair, if you, or, sort of reproductive features. And so when you think about the mons pubis, it's going to be the first feature that you see in female genitalia. And this is superior to where we have the labia, etc. Now, if we follow this internally and inferiorly, we're going to encounter the labia majora, which are the outer coverings of the vaginal opening. And then internally, we have a similar but smaller labia minora, which are the inner, more intimate coverings of the vaginal opening and the clitoris. So those two openings, majora and minora, are really important to protect the opening, protect the external urethral orifice, which is the urethral opening, as well as the vaginal orifice, which is the vaginal opening. Right. We also want to think about the erectile tissue in females, which is the clitoris itself. This is found at the anterior junction of the labia minora. So where the labia minora meet, we have that clitoral tissue, which is covered by the prepuce of the clitoris, also called the hood of the clitoris, also somewhat protecting that clitoral tissue as well. Let's look at the openings, the orifices. So first is the vagina. And the vagina, which is found at the external vaginal orifice, is basically the opening to the deep muscular tube. So the vagina itself is a muscular tube. We typically refer to it as the opening, but we want to think of it as the entire structure that goes all the way to communicate with the uterus at the cervix, okay? So it's basically found between the bladder anteriorly and the rectum posteriorly, okay, which explains a lot why we have some of the symptoms that we find, especially in pregnant women, which include incontinence, and other, not incontinence, excuse me, which include frequency and urgency of urination, and then sometimes constipation. Now, we're also going to see anterior to the vagina is the urethra, which we kind of talked about earlier, that urethral orifice, which leads to the bladder. And then this is going to be anchored to the anterior vaginal wall by connective tissue. So the anterior vaginal wall is very closely adhered to the urethra by way of the deeper connective tissue here. And again, the clinical connection here is where we have things like urethral damage, especially when we have an eventful birth. Let's say we had a birth of a really large fetus, that can sometimes injure and damage the urethra, and that can lead to more symptoms like incontinence, okay? So we want to think about those features, how they're connected, and then the relationships, how the vagina is sort of in between the bladder and the rectum. Let's look at some of the other connective tissue structures that help to anchor and secure these reproductive organs in place. We want to think about the round and broad ligaments. The round ligaments is going to run from the anterior part of the uterus all the way through to the labia majora. So the round ligament is sort of analogous with the ductus deferens in male. The ductus deferens or the vas deferens, which is the duct structure that transfers sperm, that is going to be a very analogous structure here in females to the round ligament, and it's going to take that same path through the inguinal canal, ultimately connecting it to the labia majora. Next, we have the broad ligament, and the broad ligament is really constituting several different parts. It's one large sort of sheath-like structure that is covering over the ovaries here, the uterine tubes, and the uterus. So think about it as a sheath that has been thrown over these structures, covering them on both anterior and posterior sides. So all of this long, connected sheath is what constitutes the broad ligament. And again, its main role is to secure the uterus and to provide the passageway for the blood vessels, lymphatics that are going to be supplying these organs internally. And so we can think about this as a form of mesentery. And mesentery is really the connective tissue layers that are dragging blood supply lymphatics to meet and supply these organs. And then these are covering these organs on both sides. All right. So round ligament and a broad ligament. We also have the ovarian ligament. Okay, the ovarian ligament is another one that has blood vessels within it, so we can see that here. And that helps to suspend the ovaries. It's also called the suspensory ligament. And that actually has within it the ovarian artery and ovarian vein. Now let's look more closely at the ovaries. So the ovaries are paired. These are what produce the eggs as well as the steroid hormones. And they're going to be responsive to other hormones coming from other organs like the pituitary gland that are going to help to mature and develop these eggs every month. Now, the ovum, which is the mature egg, is going to leave the ovary, be picked up by the fimbriae of the fallopian tube, and then be swept towards the uterus. And we kind of talked about that process earlier. Should fertilization occur, it usually occurs within the uterine tube, particularly at the ampulla. The ampulla is about 2/3 the way out and 1/3 the way in the distance of the uterine tube. And this is usually the site of fertilization. Now, this should not be the site of implantation. And if we do have implantation occurring here, that is what we call an ectopic pregnancy. So an ectopic pregnancy can be very dangerous, especially if it begins to grow, there's successful implantation, and it begins to grow, it can actually rupture the uterine tube and lead to life-threatening bleeding, and that can be fatal very quickly. So you want to look out for that, particularly if we have a woman in reproductive age who has missed a menstrual period, but who does not have a viable uterus a viable fetus or embryo implanted in the uterus, right? The implantation is in the wrong spot. Let's look more closely at the uterus. This is a hollow, thick, smooth muscular organ. It's between the bladder and the rectum, as we mentioned earlier. And it's really going to be the site of implantation. It's going to be made of the smooth muscle myometrium tissue that is really important for nourishing the implanted embryo and, beginning the sustaining part of, or beginning the pregnancy, essentially, implantation of the pregnancy and allowing the nutrition, the blood supply that is coming from the maternal vasculature. Parts of the uterus are going to be the fundus, the top portion, the body, which is most of the middle part of the uterus, and the cervix, which is leading right to the vagina. So the entryway from the vagina to the uterus is called the cervix. Right. So the male reproductive system is going to exist to make mature sperm cells. And then these sperm are going to basically carry half of the genetic material that's required to make a new embryo, right? To fertilize that to make a zygote. So it's important for the sperm to maintain their viability as they travel. They have a much longer distance to travel than the ovum do. So sperm must go through the tube or duct system in the males, and they also have to endure some of the environment and the features and the system within female as well. Once they are ejected into the environment of the penis, then they have to endure sort of the acidity of the vagina, the acidity of the cervical region, and then make their way into the uterus all the way through to the uterine tubes. So it's really important that they have all of the various structures and nutrition and so forth to maintain for that length of time and for that distance. Let's look at where this begins in the scrotum and the spermatic cord. So the scrotum is really the pouch of skin that covers and protects the testes. It's the outer covering of the testes made of skin, fat, connective tissue. And it really is going to help also hold them in place and help them sort of suspend from the body wall so that they can maintain a cooler temperature. Again, really important maintaining their viability. They are going to be separated from each other by the scrotal septum. So internally, both testes are separated by a septum of connective tissue. And then the spermatic cord is what's going to connect from the testes, help to suspend them as well, but also include several structures, which are the ductus deferens, the actual duct structure that transfers them to the male tract, as well as their supporting blood vessels, testicular artery, and the pampniform plexus, which is formed by the testicular veins, as well as certain muscles, the cremaster muscle, and then we have fascia, nerves, and lymphatics that also supply the spermatocord and the testis. So all of those structures together is what makes the spermatic cord. The ductus deferens and all of the supplementary blood supply, lymphatics, nerves, fascia, all of the other structures that support the ductus deferens and the testis together makes the spermatic cord. So here is that spermatic cord. Okay, we can see some of those contents here, the testicular artery, the pampniform plexus, which is formed by the testicular vein, the cremaster muscle. The cremaster muscle is really important in the cremasteric reflex, which is when you stroke the internal thigh of a male, the testis automatically elevate. That's a part of that reflex, and the muscle here is involved in that. We also have the testis itself. So the testis itself attached to the spermatic cord, we have different parts, which we'll talk about, but this is where we actually have the outer scrotum covering, protecting the testis, and then the nutrition coming from those vascular structures. Let's look at the testis more closely and look at its parts and features. Each testis is going to have an outer fibrous capsule. This is called the tunica albuginea. Tunica albuginea, which is the outer fibrous covering. We're going to see that the immature sperm are going to be made in the testis, and then they are transferred to the epididymis. So the epididymis is the adjacent structure made of these smaller tubule-like structures where the immature sperm go to mature, and then they can be transferred into the ductus deferens. And it actually looks like a comma. So here's the epididymis. It's got a head, it's got a body, it's got a tail, etc. And then this is how we find those sperm being transferred towards the ductus deferens, which is the tail of the epididymis. Okay. And so that ductus deferens is going to enter the spermatic cord with these other structures and go all the way to the male reproductive tract. If you look at that ductal system, that tract system in the pelvis for males, it's going to go all the way to the outside of the bladder. And then it's going to take this 90-degree turn. So here is the testis, here is the epididymis, here's the ductus deferens. It's going to go all the way through the inguinal canal, as we discussed, take this turn to curve posterior, and then insert into the posterior aspect of the bladder. This turn is called the ampulla of the ductus deferens. Okay. Now, before it actually penetrates it doesn't penetrate the bladder itself, it penetrates the prostate, but it's going to have to go through the back of the bladder and then penetrate into the superior aspect of the prostate, which is very close underneath the bladder itself. Now, we're also going to find another structure here, the seminal gland or the seminal vesicle. And so we're going to find both openings together, creating what is called the ejaculatory duct. So we have sperm coming from the testes by way of the ductus deferens. And then we also have additional seminal fluid. So we have fluid coming from the seminal vesicle or seminal gland. We have fluid coming from the prostate gland. We have fluid coming from the bulbourethral gland. All of these different glands are making the additional watery components that together with the sperm will create what is known as semen. So semen is a collective fluid that has sperm as well as the glandular secretions from those three glands that are going to enter into the duct system at various points, okay, forming the ejaculatory duct. All right. Okay, so semen, I kind of just described what makes semen. Let's talk about its properties. It is slightly acidic. It's a fluid mixture. It's made of sperm from the epididymis of the testes, and then accessory glands, which include the seminal glands, prostate glands, bulbourethral glands, will also secrete their various fluids as well. When we think about the seminal vesicle and the ampulla of the ductus deferens, they're going to merge together to form the ejaculatory duct. So this structure, together with this structure, both create that ejaculatory duct, which controls the emptying of these contents into the prostatic urethra. So this is where urine is being, transferred down to the external orifice. So this duct is really important to ensure that we don't have urine and semen in the tract at the same time, hence the ejaculatory duct, right? Controlling the flow of those secretions and of the sperm from the ductus deferens. If we look more closely at the male urethra, we can think about, again, it's much longer, as we said earlier. It's coming from the bladder at the internal urethral orifice of the bladder, and then it's going through the prostate. Here we have the prostatic part of the urethra. We just described how this is going to receive the ejaculatory duct. It's going to receive the contents, in a regulated way, from the ductus deferens and the seminal vesicle. And then we're going to have the second part of the urethra being the membranous urethra. This is the part that goes through the pelvic diaphragm or the floor of the pelvis. And then the third longer part of the urethra is called the spongy urethra. This is the portion that runs through the corpus spongiosum of the penis. Okay, and then eventually that is going to exit through the external urethral orifice. So the male urethra, much longer, goes through different organs and has three different parts: the prostatic part, the membranous part, which is the shortest of the three, the spongy part, which is the longest of the three. And so again, we want to make the connection here of how the male reproductive tract is bifunctional. In females, we saw a separate urethra and a separate vagina, right? So there's no mixing of those contents or those structures. In males, it's one structure that has dual function. So it's really important to have that duct that controls the flow. When urine is not in the tract, we have the ejaculatory function and vice versa. And of course, hormones and the autonomic nervous system are going to play a role in regulating that as well. Let's look at a sagittal view of male structures here. So very similar in terms of the location of the bladder, being anterior, right behind the pubic symphysis, and then the rectum being posterior, where we have the sacrum and coccyx. Now, as you would imagine, right, very intuitive here, there is no uterus internally, there is no vagina. So what we find between the bladder, excuse me, and the rectum are going to be the seminal gland. A part of the posterior part of the prostate will be found in between these two structures. And so this is where we can find, if we have, for example, prostatic enlargement in males, which is very common in older males, that can lead to things like urinary frequency, which is similar to what we see in pregnant women because of the location of the prostate, which can actually press on the urethra and then either block the flow of urine or sometimes create like an unsteady flow of urine if that prostate becomes extremely enlarged. Okay, so really important to think about that anatomy and how that can compromise the flow of urine. And this may be different than what we saw in females. Let's look at the penis itself and some of the external genitalia in male. Now, the root of the penis is attached to the bony pelvis. You can see the pelvis here, the floor of the pelvis, and then the root of that is going to attach and keep the structure of the penis. The shaft is made of three cylindrical erectile tissues. There is one corpus spongiosum, which we can see here. This is where we have the spongy urethra traveling. And then there is a paired corpora cavernosa. So the corpus cavernosa are paired erectile bodies or cylindrical bodies that together with the corpus spongiosum make up the penis. We also have the glands of the penis, which is really kind of the very distal end of the penis. And then we have the prepuce, which is covering the glands. The prepuce is sometimes referred to as the foreskin of the penis. That is typically removed in circumcision. at least in more developing countries. And then that is also the role of that, if you think about the role of it, is really to protect the glands, protect the urethral opening, where we have this navicular fossa, and secure that from any dirt, debris, dust, pathogens, etc. And so that is the original role of the prepuce. But of course, in more developed countries where there's hygiene and that sort of thing, that it has somewhat of a vestigial function and is usually removed. Okay, so that is the glans and prepuce. And if we look more closely, we have the frenulum. So the frenulum is found at the underside of the penis. This attaches the glans to the prepuce, right? So it kind of, creates that attaching point. And this is what we really are looking for when we perform a circumcision, is to interrupt that attachment of the prepuce to the glands, and then we can remove that tissue altogether. Let's look at some of the blood vessels to wrap up, some of the posterior abdominal wall arteries and veins. We want to think about the renal vessels first. So renal veins coming off of the inferior vena cava. There is the renal vein on the right going directly to the IVC. And then here's the much longer renal vein on the left, which has to travel over the aorta across the midline. Similarly, we have the renal arteries. These are coming off of the aorta, the abdominal aorta. The left side is going to be shorter, going right into the renal hilum. The right side is going to be longer, crossing the midline behind the IVC. When we think about the renal arteries and veins, they are typically going to be sort of draining different structures on the right than on the left. So for example, the testicular or ovarian arteries and veins, right? The vein especially is going to dump into the renal vein on the left, but the vein on the right dumps directly into the IVC. So because some structures are closer to the right, like the IVC, or to the left, like the aorta, we're going to see that there's sometimes a difference in how these vessels branch or the tributaries based upon what's just closer to one side or the other. So renal vein is an example of that. We can also think about the aorta. So the aorta gives the renal vein directly off on the left, and then it's going to travel behind, as you mentioned, much longer. This brings us to the gonadal veins. I kind of mentioned that or kind of got into that just now, but the gonadal veins, which are either testicular, if it's a male, or ovarian, if it is a female. And these are bilateral because we have paired ovaries or testes. And then these are basically going to be coming off of the aorta, as well as dumping into the IVC or renal vein, depending on if it's on the left or the right. Okay. We also want to think about the iliac arteries. These are direct branches of the aorta, which ends at the sort of the umbilical region here, about T10 level, and about L5 level. Then that branches to form the iliacs. So here we have the right common iliac, left common iliac, and then eventually the iliacs are going to branch again to form the internal iliac and then the external iliac. External iliac is going to become the femoral. Talk about how this is traveling under the inguinal ligament into the thigh, and then that will become the femoral artery that supplies the thigh and lower extremities, whereas the internal iliac goes into the pelvis to supply most of the pelvic organs, the bladder, rectum, etc. And then that is how we have those two branches. Okay. So very similar here, common iliac divides into internal, external. Internal does pelvic organs, external does